Now, as gun violence in America rages on, more and more people are taking notice. According to the Gun Violence Archive, there have been more than 260 shooting incidents across the country in just the past 72 hours. And more than 16,000 Americans have been killed by guns so far this year, and we aren't even halfway through the year. A new poll out conducted by Axios and research company Ipsos says that gun violence has moved to the top of the list as the country's greatest health concern. Here's how things have changed among Americans polled since February. The number one threat to public health is listed as access to guns or firearms, moving from 17% to 26%. Opioids and fentanyl dropped just 1 percentage point, and that's the same for obesity, while cancer fell from 12% to 8%. Joining us now to go through some of these results is Axios senior healthcare editor Adriel Bettleheim. Adriel, thank you so much for your time today.
Thank you for having me.
So this latest poll came out before the most recent violence, some of which we just discussed, that school shooting that took place in Nashville. Then there was a mass shooting at an outlet mall in Texas. There was also the shooting rampage that we just spoke about in Farmington, New Mexico. Regardless, how significant is this shift that you're seeing in public opinion?
Well, it's significant when you see the other big perceived threats like obesity and the opioid crisis, barely change. Since February, I think, just the drumbeat of headlines, the spate of mass shootings, it seems like every other day we're hearing about them. I think you can posit all of that has sort of focused people more on the issue in ways that maybe weren't apparent the last time we did the poll. And I think, there's a certain proximity issue. There's polling that suggests that, 1 in 5 U.S. adults have said they've personally been threatened with a gun, and 1 in 6 have personally witnessed someone being shot. So it's not many degrees of separation.
Yeah, and to your point, it does feel like it's happening more and more. So after the most recent mass shootings that I spoke of, the Republican governor of Tennessee signed a bill granting immunity to gun manufacturers, and then several Republican-led states eased restrictions on conceal and carry laws. But the former Republican Senate Majority Leader Bill Frist has said that gun violence has become a public health crisis. Tell us more about this op-ed that he wrote in Forbes and whether it might shift the opinion of those in the Republican Party.
Well, I think, guns, it's obviously viewed as a very polarizing political issue, whether in state houses or in Congress, what have you. Some see an inalienable right to them. Some see them as, weapons of death. And so it's very hard to bridge that. But I think there's also been this increased push to portray gun violence as something more than politics, a public health issue. And experts are factoring employer costs and insurance claims and mental health counseling and other variables that go into, for instance, helping the survivors. And I think Frist, who's a former heart surgeon, is kind of saying the deaths from firearms have grown into an official public health crisis, and he's calling for a fresh look to see what can be done about it. So we'll see if his voice matters in all this.
I want to circle back to something that you were just saying, because there is this economic cost to gun violence in America. I wanted to ask you specifically, who ends up paying for mass shootings? What is the financial cost like for American taxpayers?
Well, I think, the health systems absorb the cost of treating from the emergencies. And then there's often a trickle-down effect, where the health system is absorbing some of the cost. Insurance and employers, if it's employer-based coverage, are absorbing some of the costs. So it kind of gets distributed out. And because these incidents certainly are not trying to trivialize them, but they are happening in pockets one at a time, it's not something that you can tally up as easily as maybe the cost of a pandemic or something like that, where you have a surge of COVID cases. But it is significant, and it does eventually trickle down, and it may, show up in the form of higher emergency care cost, higher premiums, this sort of thing. The health system has a way of sort of passing through excess costs, and this is no doubt, changing the calculus a little bit in the cost of care.
Yeah, you're right about that. I think the research shows that gun violence in America right now is costing the U.S. some $500 billion a year. We also know that Gun violence is now the #1 cause of death for Americans under the age of 19. Now, for a long time, we didn't hear a lot about it. The CDC wasn't studying it, wasn't researching it. Why do you think we're seeing more data now on gun violence, and do you believe that it will lead to a solution?
Well, definitely the CDC for some period of time was prohibited in congressional spending bills from undertaking these studies. That was lifted a few years back. The way that these studies work, you don't immediately get numbers. So I think some of the findings are just sort of trickling out. But I think there's just generally more of an awareness and more anecdotal stories from survivors of what they've went through, and you know, just that this is not sort of a drop in the bucket after the incident, everything goes away until the next incident, that there's cost of counseling and grief therapy and time away from work. So I think there's like a three-dimensional effect that's starting to be fleshed out a little bit more, whether it's coming through public health sources like the government, or it's just personal anecdotes from survivors. Certainly the Biden administration, you're seeing them trying to get survivors a lot more to tell their stories as they make a pitch for tougher gun restrictions.
All right, Adriel Bettleheim is the senior healthcare editor for Axios. Adriel, thank you so much for your time today. We appreciate you stopping by.
Thanks for having me.
And here's another impact of the surge of gun violence in America. Other countries are now issuing travel advisories on coming to the United States. Recent countries have put out warnings like United Kingdom, France, Australia, and Canada. And Pew Research says that the gun death rate in the U.S. is 14.6 per 100,000, which is more than 14 times higher than Australia, more than 7 times higher than Canada.